Okay, so the next topic we're going to talk about nausea, vomiting, and diarrhea. Okay, so the first case, a 60 years old woman came in for because she's been having nausea, vomiting, and diarrhea from this morning. Okay, so when we asked the question and she said she went to a seafood restaurant last night and she has mild fever about 37.5 degrees and she's taking Coversil Plus, 1 tablet a day. Okay. So do you have an idea for this lady? Okay, diarrhea starting from today, and she went to a restaurant last night and now got a diarrhea and temperature. Okay, for this case, for people taking diuretic, they are more susceptible to dehydration and electrolyte imbalance. OK， 所以因为这个病人他有吃一个高血压药，可是这个高血压药里面有什么？有利尿剂，所以说，而且你看他是几岁了？60 years old. So this lady, because she's taking high blood pressure tablet with diuretic. So for people taking diuretic, they are more vulnerable to dehydration. So basically, we better refer this lady first. Okay, and then this lady just went to see her doctor yesterday and came in again, and come back today. And the doctor prescribed one medication which is called metoclopramide and Imodium. So metoclopramide is something to regulate your bowel motion, to make your bowel moves a bit fast. Okay, and also she's got IV infusion because when people have diarrhea, the electrolyte can be an issue. So that's why in the hospital or doctor, he gave the IV infusion. But now she still feel nausea and vomiting and still have to go to the toilet so many times. And she's feeling a bit weak now. Okay. So think about the problem. 所以这个60岁的这个妇女呢，她已经去看了医生，所以也做了一些处置了啊。那已经确定去医生那边看完了以后，我们就会比较好一点啊，因为他至少医生已经确认过，但是他还是有感到这个 nausea， 还是恶心呕吐啊。那你可以做些什么事情啊？但是我们先来了解说what is the causes for vomiting and diarrhea normally? So the first one, very common reason is viral infection. Yeah, you know, rotavirus, 轮状病毒啊，轮状病毒是造成很多不管是小孩或者是成年人的一些腹泻的一个很重要的原因。And the second is bacterial infection. So like Salmonella or Campylobacter normally can be resolved from contaminated food or water. And the symptom normally will start from 12 hours to 48 hours after eating those food. 所以在细菌的感染，我们最常碰见的就是 Salmonella 还有 Campylobacter 这两种。尤其我们去国外，有时候会要你打那个什么疫苗。So when you normally go overseas, the doctor normally will recommend you to have a vaccine, normally to cover the salmonella part, because sometimes can be very deadly. Okay. Another causes for diarrhea or vomiting is parasite. The first one is Giardia. Giardia 就是一种滴虫啊，所以这种滴虫的感染有时候也是造成我们腹泻的原因。所以腹泻的原因有太多的原因了，有时候你不是这几种，所以有时候医生必须要一直去尝试说用一些药物，例如说吃了抗生素治疗这个 Giardia 以后，才会去排除是 Giardia 的感染。他医生有时候用的是排除法。So you know so many causes to cause vomiting and diarrhea. Giardia can be a very rare condition, but sometimes can be an issue after patient been treating so many medication or try so many method to treat the issue, but not helping. Then doctor normally will, okay, let's try the antibiotic to treat the giardia. Yeah. If still not helping after taking the antibiotic not helping, then doctor can rule out, okay, you are not giardia, you're something else. Okay. And sometimes can be there's no gastrointestinal symptom like sometimes can be from ear infection, but you have diarrhea, or you got a UTI, but you have diarrhea, or any blood poisoning. You probably have other symptoms, everything, and also you got diarrhea. So many reasons can cause nausea and diarrhea. Okay. Other medical condition like appendicitis, 盲肠炎 or irritable bowel syndrome, 这个肠燥激症，或者是 inflammatory bowel disease, 就是发炎性的这个肠道疾病，这些它们都有可能造成恶心，还有腹泻。Okay, and some medication like antibiotic can cause diarrhea and Olistic 有没有人知道 Olistic 是什么 ？Olistic 考一下 Olistic， 或者马上 Google 一下。
减肥药吗？
减肥药对，叫做中文可能我觉得在台湾可能叫做罗氏鲜吧。对，罗氏鲜。为什么罗氏鲜会造成这个 diarrhea? So why the Olistic? The brand name is called Xenical, can cause diarrhea.
因为它可能会造成，就是它会让肠道不能吸收脂肪，然后但就是你的肠道就会脂肪多啊，就会造成你比较容易腹泻的情况，所以它会有油便的情况。
是的，没有错啊，所以这是一种情况，所以 so we can find out because the Xenical or Olistate can inhibit the enzyme to digest the fatty acid. So that's why when people have they want to lose their weight, they normally doctor or they can prescribe the Olistate. In Australia, people can get the Olistate without a prescription, but we have to advise them diarrhea is one of the very severe side effects and also can cause fat soluble vitamin deficiency. 因为它会让你造成腹泻，所以而且会影响这个脂肪的代谢、脂肪酸的吸收，所以它容易造成脂溶性维他命的缺乏。所以有病人如果长期吃这个 Olistate 的话，他们可能需要补充脂溶性维他命，例如我们知道脂溶性有 A、D、E、K 这些的。Okay, other condition can cause diarrhea like cancer, chemotherapy, or the NSAID, non-steroidal anti-inflammatory drug. Or some people, they have lactose intolerance, 乳糖不耐受性也会 or alcohol or anxiety. Okay. So in diarrhea, what is the most important thing as a pharmacist we have to know? which is dehydration. So we have to monitor, see whether this patient is dehydration. So the first we have to know what's the sign for the dehydration. The first is thirsty, or the urine become like darker, okay, or there's a little or no urine passed, or dry mouth, tongue, lip, or no tear. Okay, and skin stay up when pinched. 这是什么意思？就是当你把那个皮肤呢，把它捏起来的时候，如果这个病人是有脱水的情况，你会发现你把它捏起来，那个它就不会马上就下去啊。或者是什么呢 ？Sunken eye 就是眼睛好像就是沉下去了，或者你的 cheek， 或者是你的 abdomen 或者是你的眼有那种眼圈，你知道吗？黑眼圈，因为你的眼睛沉下去了，所以这些都是 signs of dehydration. Sign of dehydration also include you feel tired and you feel lightheaded and you can be very irritable. And also you got headache and sometimes you got muscle cramp, or your breathing can be quick or slow. 就是你的呼吸有时候会受到影响。Okay, or cold, clammy skin. So 什么是 clammy skin 呢？ Clammy skin 就是那个皮肤冷冷的，但是呢有那个好像那个水分在皮肤上面跑出来这样子啊，那挡那皮肤看起来湿湿的啊，但是冷冷的，这些都是脱水的一个征兆。OK， 那小孩子来说会怎么样呢？小孩子这个时候可能脱水的时候，他会 irritable， 就欢那个对了啊，或者是 sleepy 想睡觉，或者是 floppy 啊 ，floppy 就是 floppy 什么意思 ？floppy 中文就是可能个软软的哦。以前我们那个电脑有一个那个什么软碟，以前我们都叫做 floppy disk， 就是软软的。所以小孩子软软的表示什么？他就是表示软趴趴的，能咻咻，没有精神啊，就是 floppy。OK，then 如果 for baby 这个婴儿他会有什么情况？你按他的这个脑门有这个 soft spot， 他的这个 when you place the soft spot for the baby on the top, you will feel it's sunken。就是如果是小孩子婴儿脱水的话，你摸他的那个脑门，你会发现是下陷的，你就知道说它里面已经缺了很多的这些水分。Okay. So for newborn baby, dehydration can be even worse as we think than as adult. 就是新生婴儿跟我们一般小孩子或者是成年人，这个脱水对他们来说的影响是更严重的。那小孩子又不会说话 ，so the baby can't talk, so then how do you tell they already dehydrated? So the first, you can check the wet nappy. Normally you change the nappy maybe 5 times, 6 times a day. But for today, only 2 or 3 a day. Then you probably have to consider whether your kids has been dehydrated, or dark, smelly urine, or they feel the surge, or already 6 months but no urine passed, and the dry lip and punch mouth, 或者是 they sunken eye。所以这里有你看 ，so when you look at the image, the footage here, this is sunken eye。所以你们看这个图片，你看这个眼睛是不是很好像沉下去了，有没有？所以当你们看到这种情况出现在婴儿的身上，它就是脱水，而且是会致命的，这是会出事情的啊！因为对成年人来说，脱水一点点没关系，可是对于小孩子 他们的身体的体积这么小，缺一点水对他们的生命是有很大的影响的。所以作为药师在药局，如果你发现你在治疗病人的这个 diarrhea， 最重要的问题就是你要看他们有没有，我们要防止他脱水，这是最重要的。不是说给他什么药要止泻，这个都到其次，我们最重要的是要注意他有没有脱水的症状。So this diagram is just some sign or symptom for the dehydration for a baby. So you can have a look. Okay. And what caused the vomiting or diarrhea? Normally is infection, gastrointestinal infection, no matter from viral or bacterial. Your body can lose a lot of fluid quickly and after vomiting or diarrhea. 所以我们在上吐下泻中，我们会很快的流失这个水分。如果病人只有吐，或者是只有拉肚子，那可能还不是很严重。可是病人如果出现上吐又下泻，你看这个一下子水分电解质马上就会不平衡了。So if the patient having both vomiting and diarrhea, their body can lose all the electrolyte very quick, so can be very dangerous. 就像以前我们那个什么，以前我们你们应该有听过霍乱这个事情，霍乱上吐下泻。所以你知道霍乱为什么会死人？因为霍乱是上吐下泻，所以你只要看到有病人上吐又下泻，这个都很危险的啊！要及时的去，要么就是要止住泻或止住吐啊，要么就是要赶快去补，就是都要补充那个电解质。So it's important to drink or sip the fluid regularly while they are sick, and also sometimes the balanced salt and sugar solution are the best fluid replacement. 就是说有时候有一些好像饮料，什么样的饮料，就是里面有盐巴的，还有一些糖，一些这个 sugar 的，是最好的一个选择。可是舒跑可不可以？你有没有想过 ？I'd like to ask you a question. So here mentioned a balanced salt and sugar solution are the best fluid replacement. So what do you think? How about the sports drink? Can you use sports drink when people is having like diarrhea or having dehydrated? 可不可以？
我觉得应该可以吧，但应该是需要稀释，不然它的糖分还是有点太浓了。
Yeah, that's right. Yeah. So we have to dilute the drink. It doesn't, you still can use it if you have no other option. So 你可以使用，还是可以使用一下那个舒跑，但是你要记得要稍微稀释一下啊，因为通常里面的糖分，舒跑里面的糖分是太高，糖分太高会造成什么？会造成那个渗透压的问题，渗透压的问题会让你的水分跑到你的肠胃道更多，所以水分太高反而是会造成腹泻的。Okay, so you can tell them to drink the sports drink. It's okay, but you have to tell them to dilute the drink because the sugar normally can cause some osmotic issue, which can cause more diarrhea. So if once diluted, it's okay. It's okay. But the best option is not sports drink. Is normally there's a we call rehydration. You know, there's some medication. It's like tablet. You put it in the water, in the 200 ml water, and you drink it. Yeah. So that'll be because that is designed for to use in the human body. So they already calculate what's the pressure osmotic pressure in which is the best for the body. But if you can't access those products, sports drink you can try. Yeah. Better than nothing. Okay, so in diarrhea treatment, so the basic treatment for acute 急性的 diarrhea is electrolyte and fluid replacement. So I highlighted in red, it means this is very, very important. So the basic treatment is not to stop the diarrhea or to stop the vomiting. No. The basic treatment is electrolyte and fluid replacement. Okay. So the first you have to ask some questions. So are they taking any other medication? The first one, like Acarbose. Okay. This medication can cause diarrhea. Magnesium antacid can cause diarrhea. Antibiotic can cause diarrhea. Colchicine can cause diarrhea. Metformin, metformin, when they are in their intoxicated, 这个 metformin 当它产生乳酸中毒的时候，也会造成 diarrhea。OK，Zenacal 我们刚刚讲过也会 diarrhea， 或 NSAID 或者是这个抗忧郁药 SSRI 这个都会。OK，and so we can ask, are they taking any antibiotic recently? 因为 antibiotic can cause diarrhea, or is any blood in your bowel motion? 他们这边外国人在讲拉肚子的时候，他不会说，他们就是叫做 bowel motion。说你的 bowel motion 怎么样？这个意思就是说你的排便怎么样？他们外国人不会说他们不会有那个语言说你拉几次，不会，他是说你的 how's your bowel motion? So if you find any blood in the bowel motion, 在你的肠胃运动，他们用这个字肠胃运动，他们觉得比较文雅一点，或者是他们是不是有 any like women they are falling pregnant， 或者是现在是 breastfeeding， 所以因为我们这样有些药是不适合 pregnancy 还有 breastfeeding， or high temperature， 或者是 child or old or elderly people， 因为小孩子跟老人他们会 is 比较 weak to any dehydration， 或者是 the patient already had diarrhea but for more than 40 hours. So those are the warning signs. So 这些以上这几个都是一些high temperature 或者是小孩子或 elderly people， 这超过48小时的这个 diarrhea， 这些都是很危险的 warning signs to refer them to the doctor. Okay, the first one, blood in bowel motion. So when you notice someone have blood in bowel motion, there are a lot of possibility. Yeah, can be cancer, can be inflammatory bowel disease, or there's a rectal polyp, 这个肠道有息肉，或者是 diverticulitis， 或者是盲肠炎 appendicitis， 或 hemorrhoid 痔疮，或者是 anal fissure， 就是这个肛门有裂伤，或者是这个你的上消化道有出血，这些情况我们就是 refer， 所以大便里面有血的基本上都是很危险的。如果你发现他有这个 diarrhea， if you find the patient having diarrhea and also they found blood in their stool, it's better to refer. Okay. And also infectious disease. Okay. So in people having infectious disease, loperamide are contraindicated. 所以如果病人你发现他是有一些感染性的疾病所造成的这个腹泻的话，loperamide 就是中文叫做什么？叫做泻立停，就是专门止泻的药。有感染性的疾病，你这个时候再把它的止泻的话，会造成什么情况？When you stop the diarrhea with patient having infection, what will happen? So those bacteria or they can't go out, so they will stay in the bowel longer and causing more issue. So when people having diarrhea, why your body diarrhea? Because it's a protection. They want to get rid of those bad thing or infection or bacteria out of your gut as soon as possible. So we try not to stop their diarrhea. But what you can do is, because they're having diarrhea, they're losing the fluid electrolyte. So we offer them to supply any electrolyte or water to help. So try not to stop the diarrhea when patient having infection. Only if the diarrhea is very severe, like they go to the loo, go to the toilet 5 times, 6 times, or every half an hour. Or that's way too many times. Way too yeah. Then we give them some diarrhea tablet. 所以病人有腹泻的情况下，我们如果他又有很多的感染，其实大部分会造成腹泻的原因，很大一部分的原因都是因为感染，有细菌感染或者病毒感染造成的。所以这种情况下，我们不要使用。其实，在病人有 diarrhea 的问题，我们不是要去，不要就需要去止泻。我们止泻有时候只是症状解除，但是它的问题可能会加重。只有什么时候我们会用到止泻药？第一个 ，so when we are using the diarrhea tablet, the first is okay, the patient is safe, okay, there's no infection and they're having diarrhea, so we stop the diarrhea, okay. Or you already find out, okay, it's caused by the infection, but they went to the toilet, they go to the toilet so many times. So you want to reduce the diarrhea from maybe 6 times a day. When after taking the tablet, 2 times a day, 3 times a day. Okay, but try not to stop the diarrhea totally, because sometimes it can make the problem even severe. Okay. Okay, how about if you find blood in your bowel motion? Yeah, I think just like we say, I think, 我们讲完这个了。Okay, so anti-diarrhea medicine. Okay, if they are pregnant or they are breastfeeding. So the pregnancy category, the loperamide, which is 泻立停, is B3. So just like I say in the first class in the pharmacy, we always use category A. So even here is B1. No, we don't recommend. So you can see loperamide or buscopan, they're all B3, B2. So it's not recommended. And this one, breastfeeding. One medication is called diphennoxylate, which is Lomatil. Lomatil 是刚刚这个, this is Lomatil. This is for the diarrhea, but this medication is safe if you use occasionally for short term, but it's safe for the breastfeeding. Okay, so how about the 我刚刚讲过的 children and older person? Okay, they are at high risk of dehydration. So when to refer? So for baby less than 6 months and having diarrhea for 24 hours, or elderly having diarrhea for 48 hours, or if they already, it doesn't matter how long, if they already show signs of dehydration, we have to refer to the doctor. 所以六个月以下的婴儿，如果他已经腹泻24个小时，或者是老年人48个小时，我们通通要赶快叫他们去看医生。那或者是不管多久，只要他们已经出现我们刚刚说的那些脱水的症状，我们就要赶快请他去就医。OK， 那我们刚刚说那个泻立停 loperamide 还有 diphennoxylate is not recommended for children under 12 years old 还有就是说，因为这个 loperamide 跟 diphennoxylate is the structure is similar to the morphine so we normally have to keep it out of reach of children because sometimes the overdose can cause very severe fatal issue. 喝个水一下。Okay, and also when we realize the patient is like baby and they having the bottle fed， 就是他们如果是喝奶的这个婴儿的话，他们有时候会有一些diarrhea. So what's the diarrhea cause? Sometimes can be found in the baby having bottle. The first one is osmotic diarrhea. 就是因为渗透压所造成的这个腹泻，或者是什么乳糖的不耐受性所造的腹泻，或者是什么有时候 improper bottle sterilization 就是你的那个奶瓶消毒不是做的工作不是做得很好，所以可能就会造成婴儿都可能造成婴儿的腹泻。So when to refer， 我们刚才讲过，已经讲过了。如果 baby less than 6 months old, elderly people, that's the warning signs, or the woman is pregnant, or having signs of that dehydration, or already vomiting up or drink for more than 12 hours, for adult, but for 6 hours for kids. 如果他们已经吃什么他们喝什么就吐什么，已经超过12小时都喝不进去任何的水，要赶快去医院，可能要打点滴。那如果是小孩子的话，如果他连续6个小时都没有办法喝进任何的水，也是要赶快就医打点滴或者是他可以喝进去一些水，可是24小时还是这个吐还是没有办法止住的话，也是赶快就医或者是他的免疫力 weakened immune system refer or any underlying medical condition like diabetes or epilepsy 我们就refer 或者是说他们已经有这个腹泻，可是已经好几天了，所以这个情况意思说也不会好，这个情况就还是不要说想说自己待在家里会好就是赶快就医。或他们 vomit blood or blood green bile， 就是他们吐出血，或者是有这个连那个胆汁都吐出来了，所以这个可能就赶快也是要就医。或者是血便在大便的时候，or severe pain in the 在腹部或者是你的那个直肠的部分，肛门的位置有非常严重的这个疼痛，或者是 high fever or losing weight， 就是可能已经吐到或者是拉到已经体重掉很多，这些都是因为有些病人可能是因为他拉肚子，有可能是吃那些泻药，已经拉到这个体重都在下降了，而且下降很多，这种情况都是有问题的，有病的。Okay, so how do you what's the self-care? So if that is for baby, so could be a breastfeeding mom. So breastfeeding actually can protect against the infection. So if the mom is already breastfeeding, tell them to keep doing that, keep breastfeeding, and just ask them to do a bit more. Okay, if the baby having diarrhea or vomiting, or they have to maybe used to breastfeeding like every 3 hours or every 4 hours. Now they do ask them to do a bit more often. Or sometimes they probably need the oral rehydration solution between the feeds. Okay, if the bottle is the baby is bottle fed, so we can also offer the oral rehydration solution, and they can restart their formula or milk when vomiting is getting better, or you start with small amount of rehydration solution just a bit more often, and just try the lactose-free formula, because most of the formula they got lactose. 所以在奶粉里面，在很多的这些奶粉里面，常常都有含有乳糖，所以在小孩子如果有腹泻的情形，要继续要喝奶瓶的时候，就可能建议他们使用这个 lactose free 的这个配方。然后他们需要 clean and sterilize baby's bottle， 所以他们这个小孩子有这个腹泻的时候，他们的那个奶瓶啦，或者是奶嘴啦，这些个人的这些用品，就可能要消毒的更完全。那如果你有些父母，他们是事前先准备那些奶粉的东西，就是可能要先做好了，要马上放到冰箱。那如果时间太久，就赶快丢掉。那对于这个for children and adult, so yeah, 我们刚刚讲过了，try not to stop the diarrhea, but we have to offer them the rehydration solution to replace the food loss. So if necessary, stop the solid food. 就是他们现在腹泻的情况，有时候可能请他们先不要那些比较固体的食物，先不要吃一段时间啊。所以一直直到那个小孩子已经好一点的时候，我们再给他这些固体的食物。So after vomiting, stop keeping after the vomiting stop. 所以如果说他的腹泻停的话，就一直不断还是要继续的补充这些电解质啊。然后就是如果有饿了，就赶快吃。然后慢慢的去reintroduce the normal diet and avoid any sweet, fatty, spicy food. Okay, and the last dot point is avoid undiluted sugary drink. Because they can make diarrhea worse. 就是我们刚刚讲过了，如果你要给他一些果汁啦、运动饮料